A lot of great presentations tonight. I'm honored to be here, so thank you all for being here as well to listen. So I'm going to talk about blue zones. What are blue zones? What does blue zones activate? But I want to start with a question tonight. I'm not going to call on you, you don't have to raise your hand, but just something to ponder before we get started. We're going to be talking about lifespan and longevity. So I want you all to just take a minute to think about what impact do you think genetics has on our lifespan and how long we're going to live compared with our lifestyle choices, like Edwin spoke about earlier. Kind of an interesting question. So the Danish twin study told us that only 20% of our lifespan is dictated by genetics. It means 80% of how long we live is something we have control over, barring any accidents or things like that. That's a big deal. 80% of how long we're going to live we can impact. So we're going to talk a little bit about what that looks like and ways we could do that today. Sorry, I keep turning away from the microphone. I'll try to hold that closer. So it can be overwhelming, right? 80% of our lifespan is something we can have an impact on, but where do we start? There's so many things coming at us every day. This diet, this supplement, this way of exercising, this is what you should do to lose weight, this is what you should do to gain muscle. There's a lot to process. So I think a good place to start is to look at the world's longest lived populations in the blue zones. So National Geographic has been doing research in these blue zones for over 20 years now. Blue Zones, the company's founder, Dan Buettner, was one of the original National Geographic Fellows. These different communities and populations are very culturally diverse. You can see they're spread out around the world. Got one here in the United States, Loma Linda, California, one in the Nicoya Peninsula in Costa Rica, the highlands of Sardinia in Italy, Ikaria, Greece, and Okinawa, Japan. So when they were doing this research, they found that people in these different communities and these regions were living 7 to 11 years longer on average than we live here in the United States. That's a long time. And 7 to 11 years that were less disease-ridden than what we see here. So they started looking closer at these populations to see what were they doing, maybe by choice or just because that's what their community did, that was helping them live these longer lives and healthier lives. And when they started digging into that research, they did find 9 commonalities among the different regions and the different populations. And this is what Blue Zones has dubbed the Power 9. So these are evidence-based longevity principles that each of these communities did without necessarily thinking about them. It was just a cultural behavior or choice that everyone in those communities did, and that they believe helped them to live longer, healthier lives. So we're going to talk just briefly about each of these different circles on the Power 9. We're just going to start at the top with moving naturally. So people in these communities didn't necessarily go to a gym to exercise. We've talked a lot about ways to recreate. Here where we live, there's lots of beautiful space to go out and enjoy. In Sardinia, often the men in the family were shepherds. So they got a lot of low intensity, just walking miles a day, taking care of their flock. They also gardened. Very pertinent to our previous presentation. Almost all these communities tended and cared for gardens as much as they could throughout the year. Growing their own food is a great way to get up, down, back and forth from the home to the garden, and also ties in with some of our dietary choices that we'll talk about here in a little bit. These different communities also had a sense of purpose. They knew why they woke up in the morning. This is a picture of a 97-year-old gentleman who is spearfishing to put food on his family's table every morning. We call it ikigai in Okinawa, or plan de vida in Costa Rica. There's a reason that they get up every day that keeps them going. This is a 103-year-old woman in Okinawa holding her great-great-grandchild. She helps to care for her family during the day. That is her sense of purpose. And she says, you can see on her face here, she says it's like soaring into heaven, holding her great-great-grandchild. It's hard not to smile looking at that picture. But knowing your sense of purpose and being able to articulate that can add up to 7 years to your life. These communities also knew how to downshift, or know how to downshift. This is a picture outside of Loma Linda of a family going for a nature walk on a Saturday. Let go of baseball practice, homework, overtime, all of these stresses of bills and life, and spending time together and being present in that moment. And that ability to downshift and de-stress in a healthy way is significant in improving our lifespans. The next one we're going to talk about is what's called the 80% rule. In a lot of these communities, they plated their food in the kitchen rather than serving family style at the table, where we maybe could mindlessly just take a second helping without thinking about whether we're hungry. They use smaller plates. In Okinawa, they practice behavior choice called the 80% rule. That's where this comes from. There's an old Confucius saying, harahachibu, just meaning, as a reminder, as we sit down, that we stop eating when we're 80% of the way full, which can be the difference oftentimes in gaining weight or just maintaining your weight throughout the year. And we know weight gain can contribute to a lot of lifestyle diseases. They tended to eat a diet that was rich in vegetables, fruits, nuts, beans, legumes, things that they could grow. They did eat meat once a week on average, and on holiday celebrations, a lot of them were very poverty-stricken. They couldn't afford to eat meat more often than that, so that was a limited item in their diets. They enjoyed wine at 5 with friends and family as a way to kind of downshift, connect. In Sardinia, they drank a specific type of wine called Canonau that has 3 times the amount of antioxidants that other types of wine have. And they surrounded themselves with what we call a positive pack. So the Framingham studies show that the 3 people that are closest to us have a big impact on our lives, whether for the negative or the positive. If those 3 people that we're closest to smoke tobacco products, we're more likely to do that as well. If those 3 people are instead going for a walk together 3 times a week, we're more likely to join them. So the 3 people we spend the most time with really have a big impact on us. This is a group of women who have been friends since early childhood. They're now in their 90s and 100s and serve as a really great social support network for each other. And we all know, coming out of that pandemic we just survived, the isolation and loneliness is real and has an impact on our health. So finding ways to nurture our friendships or maybe make new friendships is really important. In these communities, they put their loved ones first. All of them. Family is very important to them. They often lived intergenerationally or have their elders close to their homes. There's something that's called the grandmother effect, which shows that when children are close to their elders, that the disease rates, chronic disease rates, and mortality is decreased for both the children and the elderly. So having those relationships and allowing your children to be close to your family is also really important. These communities also often practiced a faith-based religion or had a spiritual practice that they did with other community members, so they had a great sense of belonging. There's a lot of studies showing that people who participate in faith-based religion and go to a service 4 times a month can add 4 to 14 years to their life. It's a great social network, kind of touches on a lot of those Power 9 principles we just spoke about. So the Power 9 are great, and there's a lot of actionable items that we can do now. Maybe one of those called to you, but individual behavior change is hard. It's hard to make those changes. They're wonderful, and if you can find people to make them with you, that's even better. But what Blue Zones looks at, Blue Zones as a company, is kind of a zoomed out vision or visual. So rather than on the individual, all of that on our shoulders, we zoom out and say, what if we changed our environments where we spend the most time? At our schools, our workplaces, our faith-based organizations. We made those places where it was easier to make choices that aligned with that Power 9. So I, in my role as the executive director within Blue Zones Activate here in Lewis County, am working with different leaders and organizations, local governments, school superintendents, healthcare organizations, to bring people together across sectors and help to see their vision for a healthier community through. So partnering, collaborating, coming up with a framework and ideas that maybe accelerate what people hope to see in place is what really we're here to do for the next few years with Blue Zones. And Blue Zones has been in over 80 communities now in the United States. So it's pretty cool that we here in Lewis County get to now be one of those. It's very much a community-led initiative. So these are going to be changes like maybe having school gardens or community gardens, connecting trails, helping support healthy restaurants that are wanting to open or be in place or make changes to restaurants that are here. But it's truly only the changes that the community wants to see. It's here just to amplify kind of the vision and the things that are taking place already and maybe connect some efforts and spotlight things that are taking place around the county. In other communities where Blue Zones has been, the results are amazing. They've seen almost 3 years of projected lifespan added to people's lives, multi-million-dollar decreases in healthcare costs, improvement in workplaces, less sick days used, people are happier at their workplace, just an overall improvement of over 5% in the well-being of the communities. So it's exciting to think of what we can do all together to empower each other as a community to live longer and better. And I'm happy to take questions now or at the end if you have more detailed questions. Yes. Yeah.
Like dementia.
Mm-hmm.
Do they have less dementia in those areas as well?
Yeah, that's a really great question. So yes, they do. We actually within Blue Zones just started a dementia project in Sacramento just about 2 weeks ago. So studying the reduced risk of dementia and people who follow some of these Power 9 principles. Yeah, good question. Anybody else? Nope, okay.